Hello, everyone. Welcome to the 13th episode of the Insights webinar, a public health webinar series hosted by eHealth Africa. I am Fatima Hawedi, a project manager with eHealth Africa, and I'll be your moderator for this Insight webinar series. I'd want to welcome every one of you and appreciate you for joining in. Today's episode will focus on issues around innovating for an improved surveillance, emergency preparedness and response in public health. The vulnerability of developing nations to public health emergencies is a burning issue that needs innovative solutions. The world is gradually moving away from traditional methods of surveillance, emergency preparedness, and responses, especially in issues related to public health. We cannot overemphasize the need for innovation in the public health field. Improving surveillance, preparedness, and response has become a critical necessity for stakeholders and governments around the world. So, with no further ado, I would like to take this time to welcome our panelists, as well as our Deputy Director for Programs, Dr. David Akpan, for his warm welcome regards. David, over to you, please.
Okay, good afternoon, good morning, wherever you're joining from. Thank you, Fatima. That's a great introduction. I think you've set the tone for the conversation. It's basically very much important that we're discussing how to innovate around surveillance and epidemic response more effectively. And I know in recent times, we've seen how that had evolved very rapidly. So it's actually very nice to have great panelists who have been involved in one way or the other around emergency response to share some insight around the work that we do, in a different context, because that's very important. Because we're looking at a future where epidemic response are going to be made very much rapid and very much easy so that we can reduce any form of mortality, and even maybe stop it at the very point of, where you have the first case of any incident report. So it's a great conversation that we're going to be having today. And we have been able to graciously be honored by experts in their different fields and their right, to speak to us about these experiences. And we hope this is going to shape, the future, for public health emergency response. So welcome everyone and happy to have you. So let's stay back, have our pens and paper, have things on record that will guide our future response. Thank you very much. And we will definitely get to talk more during the Q&A session. Thank you.
Thank you, David. So the discussion today will help us map out pathways for government and stakeholders to put in place structures that can encourage innovation of public health surveillance, emergency preparedness, and response. So let's get it started. And our dear audience, please, the Q&A box is open. You can drop your messages or your questions and the people you want the questions directed to, and then we'll get to it towards the end of the session. Thank you. So our panelists are seasoned public health experts who have dedicated their professional lives to elimination and eradication of vaccine-preventable diseases. We have Dr. Abdurrahman Ahmed, Director Public Health and Incident Manager at the Sokoto Emergency Operations Center. He has participated in planning and implementation of many public health interventions, both in Nigeria and abroad. You're welcome, Dr. Ahmed.
Thank you for having me. Good day to everyone.
Thank you. Another panelist is Dr. Chuke Shalom. He is the Permanent Secretary for Expanded Program on Immunization, Ministry of Health, all the way from Cameroon, with over 10 years experience in developing highly effective primary healthcare systems in developing countries. Dr. Shalom, you're welcome.
Thank you, Fatima, and good afternoon to everyone. I'm happy to be here.
Thank you. It's our pleasure. And we have another seasoned public health expert, Dr. Salahuddin Musa, a bona fide member of the National Emergency Operations Center, Abuja. He has vast experience supporting public health intervention projects in security compromised locations in Nigeria. Dr. Salahuddin, another pleasure to meet you.
Good afternoon, Fatima and colleagues. Thanks for having me. It's a pleasure to be here. Thanks.
Thank you. Thank you, the panelists. Please, again, audience, you can drop your questions in the Q&A box, and we'll look at them at the end. And if you're with us, please drop a message and say how you're feeling now. Thank you. So let's get into our discussions. So, Dr. Ahmed, from your experience, how do you think innovation plays a role in improving surveillance in the public health emergencies? Hello, Dr. Ahmed, can you hear us?
Yes, I can hear you very well.
Okay.
Good day, everyone. Actually, surveillance can do a lot in enhancing surveillance system across the globe and in Africa and here where I live in Nigeria. There are a number of ways. When we talk of innovation, is looking into what can be done new or improving what exists. So through innovations, you can build in data collection processes, you can build in data analysis process, you can build in data sharing processes, which we know the main hindrance that we are experiencing now with the surveillance and the traditional surveillance system is being it analog. So being it analog, it means there is limitation in sharing data among different organizations that need to come in together and detect cases quickly and respond to them timely, which most of the outbreaks that we have start with an index case, which is one, likely. So once you can be able to detect that index case early and handle it well, the disease ends there. It will not even reach the magnitude that you call it outbreak, not to talk of coming a pandemic or something of such nature. So innovations can do a lot in ensuring that we detect cases as soon as possible, timely, and share them with neighboring societies and communities so that they take proactive measures before it reaches them. So through innovations, data collection mechanism can get better as we go into, as the webinar continues. And then data collection, automated data analysis with the conclusion drawn using innovations. So which can help governments, policymakers, actors, that's field workers also. It will give them insight as to quick wins and quick measures that they can take that can actually address the conditions before they escalate and go beyond the conditions that can be handled. Similarly, innovations can be used to enhance simulations and giving room for training such that without going abroad from whichever society you are, you can get simulated trainings which can enhance your capacity to respond to events when they happen in your domain. So this all can be achieved through innovations. And several training modules and other processes can be used. Technology can equally be used in data mining, where you can have the use of artificial intelligence, the use of machine learning, deep learning, and all sorts of innovations that can go into social media, extract relevant information regarding diseases, regarding outbreak for you while you are seated, and this can alert you to quickly swing into action, develop preventive major barriers, and all other necessary things that you need using innovations. So innovations has a lot of contribution that it can give to the surveillance system that can truly help us to see that we contain diseases as they happen, and we avert a number of outbreaks, a lot of lives saved, a lot of resources saved in terms of commodities that will be needed to respond to the outbreaks when they go into the large magnitudes. I think I'm giving 5 minutes. I don't want to go into much of the times, but there are a lot of things that actually innovations can do to enhance surveillance activity. Thank you.
Absolutely, right on point. You made mention of early detection, the use of data to make decisions, and capacity building is absolutely right on point. So thank you so much. Thank you. So Dr. Shalom, this is a question for you. Can you hear us?
Yes, I'm hearing you. I won't open my camera because my network is not stable. So I want people to hear me very well.
Yes, we understand. Thank you. Thank you. There's always a plan B.
Thank
we
you.
want to find out from your vast knowledge of effective primary healthcare systems, what are the practicable recommendations you have to improve surveillance, emergency preparedness and response in this sector?
Yeah, thank you again. I want first to apologize for my English because actually English is my second language. I'm a French speaker. During my experience in primary healthcare as a district medical officer, we have noticed that for every health intervention, community participation is the key for success. Even for surveillance, if we want to succeed in surveillance, we have to integrate the community-based surveillance, and this community-based surveillance is not it's driven by innovation. I think the most practical recommendation is to adapt the architecture of the surveillance network to integrate both the community stakeholder and innovation adapted to the level of the community. So the practical example we had in this area is to train many healthcare workers in community level and gave them phones, appoint one focal point in every community, and we share the phone number of this focal point for community surveillance so that he can receive an alert from everyone from the community who have noticed an unusual health events. That is the first practical thing that's really easy to do in every environment. The second one is for the government to have a good policy of innovation in surveillance system, given that in surveillance we have two objectives. First is to detect all cases of a disease that can potentially have an outbreak, all cases. And the second objective is to detect them very early. And that is the first responses to every outbreak and to every pandemic is to detect all cases and to detect them very earlier so that the response activity can be done and stop the spread of the disease. Given the objective of the surveillance for that is, we cannot only limit this activity to healthcare workers. That if we want to include community health worker and integrate innovation, there is a simple way to do that is to have an agreement with mobile operator to create a green number that can be used by every citizen to report any unusual thing in the field of public health. We have tried this one during the COVID-19 pandemic the 1510 is a green number in Cameroon to report any unusual events in health issue. When we have started this innovation with 10 call center in every region, we reported many cases of suspected cases of COVID-19. Not only COVID-19, we have extended this to report any cases of not only human health, but integrate only livestock. It's livestock and livestock. This is the name in English. Livestock events like monkeypox. And I will stop at the third one. The third one is for the government, not only to have the agreement with mobile operator, but I think the incentive for community and any individual that has successfully reported something that have been confirmed in lab should have an incentive, like we have done in Guinea worm surveillance in post-certification period. For every individual that have reported successfully a case of Guinea worm, there was an incentive to them, and that helped us spread the communication about disease under surveillance. These are three more practical things we succeeded in implementing the innovation and the improvement of surveillance in our milieu in Cameroon. So I'm here again I can again go in depth if there is a need of clarification. Thank you.
Thank you so much, Dr. Shalom. Indeed, it is paramount to have community surveillance based activities at the community level, so that's where we get the information from, and then it can be related and cascaded to the necessary authorities and reported. And you talked about having the toll-free numbers here. We call them toll-free numbers in Nigeria from the call centers during the COVID times. And another innovation is for us to get incentives, maybe based on transportation or call credits. That is well noted. Thank you. Dr. Salahuddin, good afternoon again.
Good afternoon.
Okay, so we'd want to find out from your perspective, what are the most important factors to consider when we're scaling up or we're maintaining these innovative surveillance systems in the public health space?
Thank you very much for your questions. I think one of the few important factors to consider in scaling up is the success of the pilot is very key, because in any surveillance or any project, it just don't roll out. You have to conduct some low-level pilot using some fewer population and figure. How successful it is. The outcome of that will tell you how it is understood by the implementers. Of course, success of the pilot is also dependent on how well they understand the new technology, the innovation you are bringing on board. And that has a lot to do with communication and training for them to understand what you are bringing on board. In question, one clear example is the deployment of Avada in AFP surveillance and the success that came with it. And if you recall very well, for those that were part of that project, you will understand that we started as a pilot. From a pilot in a few LGA, the success of that, was what informed the gradual scaling up within the state, increasing the number of the LGAs and increasing the number of states where we eventually deployed Avada. So the understanding by the implementers, the rigorous training involved, and led to the success of the scale-up. And of course, you can't ignore the contribution of money, the finance. what is the cost implication of the project and what is the cost implication of expansion vis-a-vis the health benefit it brings. Once that is well understood and source of funding is very well available, then the sources of expansion becomes very easy to achieve. So for me, the major critical factors in expanding innovation, apart from understanding the sources of the pilot, the knowledge of the implementers, it also, the cost benefit is also very key. And of course, funding for the project to expand. These are the key determinants of the expansion of any innovation in surveillance field. Thank you.
Thank you, Dr. Salahuddin. That's really true. But I want to find out a follow-up question to that, since you mentioned about, scaling up funding and communication. So what about sustainability?
That's
we
also
can't
very
get funding
important,
forever. Yes.
Because that is also very important. But you also know that sometimes when you talk about sustainability, it depends on the context you're looking at it. In our society, especially with the present economy, you see that sustainability can be a big burden for the local community. So some of this has to be supported for a while before we gradually transit to the government or to the institution that can rightly own it. I'll come back to Avada again. You see with the success of Avada, it transited to multi-disease, initially from AFP, then transited to multi-disease, initially just resident within the probably MPHCDA, but you can see that now it's transiting to NCDC. So once technology is very helpful, always there will be sustainability, because the major actors will see the value added to the indices, and owning it will become a very big advantage. If the funding partner leaves, we'll probably see some other partners that sees a way to sustain the program for the larger benefit of the society.
Thank you. Thank you so much. So we're moving back. Please, audience, a gentle reminder again, we have the Q&A chat. Please drop your questions on who you are directing the questions to, or just drop an emoji on the chat telling us how you feel so far, and if your pen and paper, your book is full or something from all the knowledge that we have learned. And now we're going to go back to Dr. Ahmed. Dr. Ahmed, I want to find out if you can actually give us some examples of these innovative technologies or approaches that have actually successfully worked in public health surveillance. Dr. Ahmed, can you hear us?
Thank you, Dr. Fatima, and our participants. Actually, there are a number of innovations that are so far put in the field that are still showing promising results. One is the use of artificial intelligence, as I mentioned earlier. We have a number of applications that are developed globally and also here in Nigeria where I am, including health map and an app that was developed by Nigerian Center for Disease Control called Tata4. So these are data mining applications, which are surveillance tools that will be looking into the social media across board, Facebook, Twitter, Instagram, and the rest of the social media, to using natural language programming to detect anything that talk about disease, outbreak, or a typical disease like yellow fever or something, and they pick it, gather it, and then send the signal. So which the monitors are there that are sensing the signals as they come, and this can help to localize where possible outbreaks are taken, and then the local people there will be, local health workers, frontliners will be sensitized. They may not be aware of the system, remember, and then they will swing into action. That can help, or that help in early detection of a number of diseases so far across the globe and also here in Nigeria, and mounting immediate response. Aside that, we have use of mobile phones. In Nigeria, we have what we call SOMAS, which stands for surveillance. SOMAS is surveillance of outbreak and response management system. So this is a software that is mounted on a mobile phone, which health workers at the grassroots can use to send information on surveillance, events, diseases, surveillance data generally. This data, once sent using mobile phone, it will go into a database, which anybody that has access to the database can see and take informed decisions. So these are some of the innovations that really work for us. We have the use of what is called Internet for All now, where you use devices, physical hardware with sensors that can be getting an information and sending them. Example is we have smartwatches now that have linked to measure the heartbeat, the number of hours you spend sleeping, and the rest of it. This is helping a lot of people at the moment as we speak, although the potential is not fully explored. So there is room for exploring this opportunity later in life, where it will be sending information directly from people to a regional level or even to the international level. And that data can aggregate, analyze using deep learning machines and machine learning to make a lot of sense with analysis that will be giving the policymakers leeway as to what is happening with their populations and what action need to be taken. We have syndromic surveillance that is instituted, which is working, which is aside the typical surveillance system that we have. The healthcare worker has to go into the registry, start looking at what is happening, how many people presented with cough, diarrhea, and fever, the rest of it. No, syndromic surveillance is looking into as symptoms are happening, whether they are related to what is captured in the case definition of diseases that we know or not, they can be picked and transmitted, and then the data can go to the center, and center can make sense of it and make analysis and take decisions. We have, this is working in a number of countries, including Nigeria. We have real-time data analysis, which is happening here in Nigeria through COVID-19. A number of dashboards were sent to various states in the country, where as the surveillance actors are sending information using SOMAS, as I mentioned earlier, it is going into the center, and state specifics can be monitoring their dashboard, which is located at the center. As cases are coming in, they are popping in into the dashboard. So this can help the surveillance actors to know whether we have reached the threshold or not, or if there are diseases that one case is an outbreak, like polio, like yellow fever, you know that once you see a case, you have to trace where that case comes from and which action needs to be taken in order to prevent escalations, just diseases like Lassa fever and the rest of them. So these are situations where we are having either fixed dashboard or dashboard on a mobile phone that you can log into and just see what is happening with respect to what you truly need. So these are actually some of the surveillance system innovations that took place, and they are helping in a number of ways. And as Dr. Salau said, we have AVADA in the country, which is audio visual AFP surveillance system that uses local people that are given a mobile device, a phone that is mounted with an app that they can use to take picture, take the other record of the cases and send it. And this will be aggregated. Also, necessary actions are taken using the information that are getting from the AVADA actors. So this is something that will not just use text. The pictures of the cases are there. Easily, a case of AFP can be rejected from the picture that is sent. And easily, those that have the knowledge of the acute flaccid paralysis can easily say, yes, this picture is likely going to be an AFP. So it's an innovation in surveillance, which actually has succeeded. All is left now is for the full scaling up countrywide and to every community of this surveillance system. It's going to be costly, but when you look at the contribution is cost effective. We have in Nigeria, sorry, I'm taking a lot of time. I'm giving last example, then I will close. So we use different ODK platforms, and in Nigeria, we implemented eIDSR, so which are all innovations. We know IDSR was introduced not only in Nigeria, so which is improvement in the surveillance system to ensure that events are reported, not only diseases per se. So there was a move to go into e-surveillance, where electronic IDSR, which is being implemented in Nigeria amidst other countries. So these are all innovations that prove to be really worthy of scaling up. So, and with all this, and let me not forget with the district health information system too, which is not unique to Nigeria, but also being implemented in Nigeria where I am. So these are all innovations in surveillance that can actually, that prove worthy of scaling up and getting larger acceptance for interoperability among different countries, different communities for enhanced surveillance. Thank you, and sorry for taking more than 5 minutes that was given to me, I guess.
It's an absolute pleasure hearing you talk, sir. It's okay. We learned a lot, and I believe the audience are here pouring out some questions for you as well. So we're going back to Dr. Shalom. I want to find out your perspective on integrating community engagement into, how it can actually improve surveillance and have better public health outcomes by involving the community. What is your situation in Cameroon?
Cameroon, yes. Thank you again. As I explained in my first speech, we cannot succeed without community engagement and and without community participation. And the community engagement now is not like passive engagement as we experienced before the COVID pandemic. The community need now an active participation based on their knowledge, and the knowledge comes from data, from research. The community engagement should rely on facts to engage them for sustainability. So I think, again, for surveillance to be successful, it is not only a selected member of community that should be included, involved in the surveillance system, knowing that the disease pattern can change with climate change. we cannot limit ourselves in certain number of diseases under surveillance, as we know in IDSR. We should integrate every health event that can be reported, not only by a selected member of community, but by everyone. And for that, all the surveillance architecture should be adapted to the community level for them to be engaged individually first and as a community in second. To get them involved individually, it is a matter of conviction. I don't know the real translation in English, but conviction is that it's not only based on information you provide to community in order for them to adhere to your intervention, but it is a conviction based on the risk and on the benefit of their involvement as a stakeholder in community health, in community surveillance, and in community to protect all the population. So if we succeed to involve them individually as a member of community, it will not be easy. The first thing we have experienced something here in Cameroon is to involve them in micro planning. In micro planning, give us a risk analysis of outbreak. Micro planning is not only for immunization; it is integrated micro planning for all components of primary healthcare. Micro planning with community involvement start with risk analysis, disease risk analysis applied to the local context. Based on the disease analysis of outbreak and for diseases, there is like awareness from the community based on the risk of disease, based on the benefit of intervention that they have identified together with healthcare worker in their community. This is the first step for their involvement and their engagement. The second thing is to have auto monitoring. Auto monitorage in French is like monitoring of community indicator on surveillance and in health data. But now at the third step, we included innovation, and we leverage what we have learned in Avada project. I was the regional officer for EPI in Fano when Avada project started with EHF, and thank you again for the EHF support for this project. What we have learned from Avada is that the community definition of disease should be really adapted to their level of understanding and their level of understanding of technology, with automatic video playing every Monday, showing the simple definition of disease for polio. But it will be better if we extend all this video definition to all health events and showing them every week what is the risk in their community, to report all events, including polio, measles, and other health events. It is a project from now. It's not. It needs a level of expertise to implement that, but it is something that is considered in our plan to improve the surveillance network and to include to involve community worker. The last thing for that, it is I think someone has mentioned it. It's to include to benefit from artificial intelligence. Artificial intelligence, I don't have a good understanding of that, but I know that it can improve the data, not the data collection, the data interpretation coming from health record, newspaper, social media, report from every individual that can report every health event, to put all this data together and to show a risk analysis of every health event in the community. I think the artificial intelligence now is the new trend of innovation that can come at the level of community. And we should start to engage our community leader by first doing an awareness to get them involved based on the risk and the benefit of their intervention in health, in disease surveillance. For now, that's my opinion on that. And I can again reply on some comments in Q&A. Okay, thank you.
Yes. Thank you, Dr. Shalom. I saw that you have made some remarks on the Q&A. Thank you for doing that. And Dr. Salahuddin, there's a question for you. We are now going straight into the Q&A session because time is not on our side as usual, but I'm glad we're here and I hope we're enjoying this and benefiting so much from this wealth of knowledge. And please do remember you can drop your questions on the chat box or the Q&A, and then we can ask our panelists to give to give answers to them. So we have one for Dr. Salahuddin. It's about the AVIDA as the success story, working out in terms of sustainability, looking at the current incidents happening across the states. It concerns if we will figure it out to innovating for an improved surveillance, emergency preparedness and response in public health for personal solutions or near to that. So Dr. Salahuddin, this is a question for you. Is AVIDA a success story and is working towards the current incidences happening in the state?
Yeah, thank you very much. Like I mentioned earlier, I think it's a success story that has led to having it as a multi-disease reporting platform now. And the success we achieved with AVIDA in polio. The sustainability of that, based on the current funding, I think is with NCDC. And I believe that it will continue to be relevant in reporting diseases and analysis of those reports, helping quickly in policy making to prevent outbreaks and prepare also where outbreak occur to respond to them effectively and efficiently. As other panelists mentioned, we cannot underscore the sources of innovation in surveillance. And if we look at the figures and its contribution to AFP detection and eventually certification of Africa as being polio-free, I mean, you cannot underscore the, the resources. It's a legacy. And just starting from 2 states initially, and from 33 cases within the first 2 months, we scaled up to how many cases? I mean, you saw a contribution in 2016 of just 33 cases within September to October. Then, scaling up to 4 states in 2017, and we had a contribution of 4% overall across the country. Considering that only 4 states were involved, they were able to report as much as over 300 cases. By the time we scaled up to 6 states and eventually 11 states, their contribution was almost about 10% across the country, average. But if you take it just limited to just AVIDA implementing LGAs, you'll get as much as 30% in some cases, considering that even not all the LGAs within this state actually have AVIDA platform for one reason or the other, either due to network or for whatever reasons. So innovation will continue to be, I think, the way to go in terms of surveillance. And AVIDA as a tool is one tool that we cannot throw away. Sustainability may be a challenge at a point, but I think as we expand and as we bring in all the disease platform, the cost benefit will continue to improve and the funding gap will continue to be closed eventually until it is completely or 100% taken over by the government or by other partners that can help sustain that innovation. Avada is a good example of how innovation has helped in improving surveillance. Thank you.
Thank you, sir. Mr. Haruna Kaita, I hope that answers your question. Now we have another question for Dr. Shalom from Mr. Sunday James. He said, with COVID, etc., we have seen that public health emergencies transcend national borders. How can innovation facilitate international cooperation and information sharing during global health crises?
Yeah, in fact, it is really challenging. I can link the first question to the second, talking about the privacy and
Yes.
data security. The two questions are really linked together. Yes. My opinion, it is really a great challenge because the need of collective protection must not affect the fundamental freedom of privacy and data protection. Government must have adequate law to protect individual data, but without compromising the knowledge and risk of disease. There is a framework for international data sharing in international health regulation, but when you go through this international health regulation after the COVID pandemic, it is clearly, you can notice clearly that there is a need of update of international health regulation. The data sharing should be based on agreement, and we are looking forward to have an agreement for data sharing with Nigeria for cross-border events. We had many transborder meeting with our colleague in Nigeria from the north to the south. And we clearly understood the importance of sharing data about what is going on in every country as emergency, like measles in the north, like cholera, like yellow fever, like hepatitis E. That is some of example we have succeeded really in sharing our data with Nigeria and have a common responses to these diseases. We can just rely on our individual partnership with neighboring country. At the international level, it's really difficult to have one policy that can be approved by individual country. This is my opinion, but we have a long way for that. But for data privacy, it is also challenging because in many African countries, such as Cameroon, there is no any regulation that protect individual data in health. You can notice that we are sharing line lists for polio cases, for AFP cases, and measles cases with international body like WHO with that with name, allocation, sometimes with geocoordinate. I think it is harmful. But technology can allow us to remove individual data and only share what is important to risk analysis and to take action to disease and outbreak responses. That is my opinion, and thank you for asking this question. We are still working on that as public health expert and as a government. Thank you again, Sunday.
Thank you, Mr. Sunday. I hope that answers your questions as well. So we have a chat from Professor Abubakar Jafar Usman. He said, the innovation so desired to improve surveillance, preparedness, and response is all-inclusive approach to workforce capacity development while leveraging on digital technology. Dr. Ahmed, what do you have to say about this? Hello, Dr. Ahmed, are you with us?
Yes, I'm with you. Thank you very much. I raised my hand earlier to add little about what Dr. Shalom said about the Dr. Sunday's or Mr. Sunday's comment.
Yes.
Actually, communication with different countries is very, very essential to ensure global health security. And that can take many forms. As I said, number one, deliberate communication between government agencies is one way. Another way is data mining using artificial intelligence, as I said. ProMed mail is there, Health Map is there, Tatapo in Nigeria is there, which can be used beyond boundaries to extract information wherever it is happening that really can put government in advantage position before diseases reaches their borders. So aside the local communications between Ministry of Health Cameroon and Federal Ministry of Health Nigeria or Federal Ministry of Health Egypt, recently we received alert last month through of anthrax in neighboring African countries. So, which was fully communicated with Nigerian government, and Nigerian government acted by sensitizing the populace and the government agencies at various districts or states in Nigeria to take necessary actions in order to halted the spread of anthrax into the country. So this is one way, aside the local in-between towns of different countries, different states, they can easily, the health districts within the countries can actually communicate, but technology can be used honestly to enhance that. And with regards to the data security, honestly, this is a question that a lot of debate globally, that we are using smartphones and sending our personal information to where we don't know. So how do we protect the privacy of the individuals whose data is being generated and sent to the cloud? That yes, there are a lot of layers of security to prevent whatever goes to cloud, but we know there are geniuses around the globe that are diving into those informations and making a lot of money out of them, compromising the security of the owners of the information. So, but what is very critical is sensitization of the people in general through our communication network, to be mindful of their own security, not using one password for all the gateways that you have. Of course, once that gateway is compromised, and that is what you use in all the other gateways, all your privacy is gone. So that is one. And having a record of where you archive the passwords locally, not in the cloud, I repeat, is also compromising that for people that are within you, but people that are outside your domain, you are secured. So these are a number of ways, but sensitization is the key in terms of privacy of the people that the data is generated. And by principle, if you are sharing any information with anybody, any identifier should be missing. Identifiers should be missing from the information that you are sending out. But issues of interest, height, weight, gender, socioeconomic status, symptoms, these are not unique to any individual. But my name may be unique to me, my phone number may be unique to me, my email may be unique to me. So all these things supposed not to be shared with outside world. So these are some of the steps that we can take to ensure the security of the privacy of our participants. So sorry, I want to answer the question you posed. Can I get the question again, please? Sorry.
Yes, sure. I will put it right up. It is a question from Professor Abubakar Jafar Usman. He said, the innovation so desired to improve surveillance, preparedness, and response is all-inclusive approach to workforce capacity development while leveraging on digital technology.
No, this is very correct. Even though the innovations may go beyond digital. Yes, eventually it may all come to digital world if we need to have interoperability where communication, as Sunday raised, we need to have that quick communication, then we have to go digital. But in my opinion, is not limited to only digital. As I mentioned, the syndromic surveillance, we are looking into how do we take symptoms that are not traditionally reported. So, and if we look at the principle of integrated disease surveillance and response, it's not looking at specific diseases, even events. When events happen, they have to be reported. So that report can go through digital way, can go through a local health authority, can go through various means. Wherever that information can be coded and decoded and then action taken is fine. It, in my own opinion, it doesn't have to be digital only. So it can go beyond digital, but honestly, for enhancement, digital is the best way in terms of innovations and when we are looking at efficiency. But it can be done even without a digital means.
Thank you. Thank you so much. So thank you, everyone. We have 3 more minutes. I know time just flew by. It's unbelievable that we're already at the end of this insightful webinar. Thank you, my panelists. Thank you, the audience. We really appreciate your time. And I hope you found a lot of this information very insightful and helpful. So please don't forget to follow us on our social media handles, and then you get more information from eHealth Africa, and then the information of all our panelists. And if you have any other questions that we're yet to answer because of the constraint of time, we'll actually post them on our social media handles. And in 1 minute each, I would like all my panelists, please, if you could say how we can actually work as a community to actually ensure this innovation of surveillance and emergency preparedness and response. Thank you. Hello.
So do I start?
Yes, sure, sir. Of course.
All right. So my message to all of us is let us not be economical with information. We need to share information. This is a fact. And that information, when we share, is going to help us and is going to help somebody somewhere that will be needing it dearly. So it's not an era of hiding so that it's only me that know. This is my general advice. We should be generous to share information among ourselves, among different colleagues, so that collectively we can ensure global health security is ensured. Thank you.
Thank you. Dr. Salahuddin?
All right, thank you. I think we should all assume that we are all disease surveillance and notification officers. And that role is not just limited to someone appointed by the government or by partners or whatever, but each and every one of us we are a disease surveillance and notification officer, and it's been made easy by mobile phone technology.
Yeah.
Whatever is strange to you, even if you don't know it, taking a picture of it and posting it out there provide a platform for people to know what is happening and for you to be guided on what needs to be done, and it's easily picked up, right? So
Yes.
I think we should all go out there with that token that we are disease surveillance and notification officers. Thank you.
Thank you. Thank you, Dr. Salahuddin. Dr. Shalom, all the way from Cameroon.
Thank you. Yeah, for me, world is changing too fast, and the health too. Climate is changing too, and this environment is really changing. And in this environment, we should be dynamic and be flexible to every health issues, and not stuck in our business as usual. And then innovation can help us fast track this dynamism, and maybe go faster than the disease can do. Thank you.
Thank you so much. And I would like to invite Dr. David Akpan for his closing remarks, please. David, over to you. Thank you once again.
Thank you, Fatima. I will make it very short. So thanks, everyone. I think we had an interesting conversation today, a lot of insights, and that's why we had this webinar, right? And we could listen to the context, the innovations applied within those contexts. So it was a great time, and we hope that this is going to really, push forward some of the work that we do around public health emergency response. So we thank our listeners, and we hope that you will stay connected to our subsequent edition of Insight webinar. We actually had to reschedule this because of the public holiday, and I know that's why we are not having a good number of persons, but we are going to share these on all our social media handles, and we're going to tag a couple of persons. So do well to share, so that the communities out there will be able, communities of public health, actors, planners, innovators will be able to benefit from this conversation. Thank you, and let's see again next month on about 26th, thereabout, or the last Wednesday. Thank you so much. Bye.
Thank you, David. Thank you, dear panelists, and thank you, the audience. And we really appreciate your time. And don't forget to follow us on our social media handles, drop a comment, and drop your suggestions for upcoming webinar topics that you might want us to actually invite the subject matter experts to. Thank you all, and have a good evening. Goodbye.